Hello.
Hey Joe, how are you?
I'm well, Shashi. How you doing?
Good, good. You can hear me and see me okay?
Perfectly well, thank you.
Perfect.
What what a crazy time, huh?
I I'm at a loss of words.
It lends new meaning to my God, being alone. Did I lose you?
You stopped your video. Can you turn back your video? So yeah,
Yeah.
perfect. Yeah.
Good.
Are you doing it from your phone?
Yeah.
It's quite clear. It's great.
So what have you
You froze, Joe. You
you
froze
there?
for a second. Sorry, yeah, there you go. I got you back.
How are you spending your days?
Doing some consoles, doing some webinars, working with the Simplast team, reading a lot, doing walking, exercising a bit, drinking some wine, cooking a little bit.
Enjoying life. Yeah.
All of the above, which I haven't done in a while, so
Yeah. Well, it's amazing to think of how hard we work all day and all the things we're doing now. We try to integrate into some part of our day, and you just realize that I don't want to say we're doing nothing, but we're not actually at work. But I find my days are completely filled and busy. And I get to the end of the day and I go, but I would have worked this entire day. I would be coming home now and I'd
right,
have all of this. And you just realize how nothing ever gets done because it's just too much.
right,
So
right.
overwhelmed.
Yeah.
It's just a different kind of work.
So it's probably a loaded question, but I'm going to ask you, are you going to change your work, kind of schedule a bit?
I think I am. I think I am. I'm
Hey,
going to
John.
interview someone who potentially could be an associate for me.
Okay.
Um, do you hear me?
Yes, yes. You froze for just a second. John, can you hear me?
Yep, I can hear you.
You can hear
Hey,
Yeah.
us?
John. Joe Russo.
Hey, Joe.
You see,
I think we met once before down in Shashi's office.
did you have a beard at that time?
No, I did
No,
not.
And
this is
yeah,
this
yeah.
is the COVID beer. COVID
COVID
beard, I
beer.
should say.
Yeah, yeah.
There's a lot of those going around.
I bought beard oil for the first time in my life today. Try to soften this thing up. It's a little prickly.
Looking
Looks
good.
good. It looks good, John.
Yeah, I like it.
It suits you.
I wasn't sure if I looked like a mountain man or Kenny Rogers. So,
Let me hear you sing. I can tell you.
See, there's a difference always when somebody who's bald grows a beard versus somebody who's got a full head of hair grows a beard. I think the bald man always tries to cover up the deficiency, and the one who has the full hair looks distinguished, in my opinion.
yeah, I don't know. There's some bald guys who rock the beards pretty well.
Yeah,
Yeah.
yeah, yeah,
Very few. Sean Connery may be one of them.
yeah, yeah. It's good. You're right.
All right, guys. Let's just kind of, we're gonna keep it short so that it's nobody wants to listen to an hour, anything of any type. But we'll try to keep it about 30 minutes. And the idea is very simple, and this is being recorded, by the way, so I'll share it with you guys if you want to use it, obviously. So you can clip out the beginning part that we're just kind of prepping, and you can clip out the end and just use whatever you want to use as a small segment of stuff for Instagram or YouTube or Facebook or whatever you want to do. I'm certainly going to do that and share with the people. So the purpose of this is very, very simple. The purpose is, first and foremost, what is this new social media that has explosion of information and education, like constantly bombarding the consumer base, and it's very difficult for a lot of people to decipher what's accurate, what's not, what to listen to and what's not, because suddenly everybody has a platform. So instead of ignoring it, one of the goals is then doing it alone. One of the goals is, surgeons like us who, have a say, and, I believe at the top of the food chain need to have, a strong presence and content that I think can deliver customers to all of our practices, and, make sure that we kind of cut through the clutter and provide good content for people. That's the first thing. The second thing is, I again believe that we have bequeathed or kind of let go of this non-surgical area, which is the fastest growing, and I think would continue to be a very, strong, performing area of the future to people who are non-surgeons. And we've kind of relegated ourselves to the sidelines. And one of the things that I always talk about with the colleagues is our need to stay in the conversation and also make sure that the customer base understands that we have something to offer, actually the best thing to offer, safety to offer, experience to offer, and combination procedures to offer, and management of complications to offer, and all those things that only we can do because of our background. And I think the customers need to know that. And another thing that cemented this thought of mine just recently is a patient that I've operated on 2 or 3 times already had no clue, and she didn't even associate doing her Botox and fillers with me. And she said, I was just going to go to my other doctors. Like, I never thought of you doing that, or your office doing that for that matter. And I can just blows my mind, why people would not associate that. And I think, maybe we're not doing a good enough job talking about it as other people are, and, people are interested in. Okay. So that's another reason I feel like us surgeons need to participate. It doesn't have to mean that we actually have to do all of the procedures. It just means that we have to direct and supervise and guide it within our auspices and our offices and under our guidance. So that's the purpose.
Mm-hmm. Yeah, I like it. I think we have a lot to offer, Shashi. I think you're right. And it's an effort to take back some of the property in this space, which we should be running.
Right. So I'm going to get started. It's just an open-ended conversation. It can be very casual. You can ask me, I can ask you, we can ask each other just some thoughts, and I'll start with, okay. So Dr. Russo, my good friend from Boston, welcome to our Zoom meeting.
Thank you, Shashi.
And Dr. Taylor from New Jersey, also my good friend, welcome to our, little Zoom meeting. And for the audience at large, these are very good friends of mine who are fellow plastic surgeons, a little bit older than myself, but not that much. Just a tiny bit. But we're very, very dear friends and colleagues, and we think alike, and we have, similar aspirations and goals of what we like to offer patients. And so we're taking this time, during this, COVID time to spend a little bit more time talking about what we do, how we do things, exchange more ideas and collaborate more. And most importantly, connect with patients the most, because typically as doctors and as surgeons go to meetings and talk to each other a lot, but it seems that we don't talk enough and educate the patient base as much as we should. And nowadays, with the availability of technology to reach patients directly, I think it's a good medium to to talk about what we do and our views and viewpoints on aesthetic services, cosmetic services. So welcome.
Thank you.
So Dr. Russo, would you like to just introduce yourself to the audience?
Sure. I'm a board certified plastic surgeon. I've been in practice for, I guess, 28 years now. And interestingly, and I think you guys probably will agree to this, that when we first started in plastic surgery, there really was a very small aesthetic component to it. And we really didn't have any of the things we have now. So when patients came to see me, I had 2 things to offer them: either surgery or no surgery. That was it. We really didn't have Botox. We really didn't have anything significant in the way of fillers. We didn't have laser. We didn't have radio frequency. We really had very, very few tools. And over the course of the last 10 to 15 years, the industry has totally exploded. But I think we're in a position where we've seen it all. We've been in a position where there was nothing. And now you see that the curve is just becoming exponential in terms of new technologies that have been introduced. And, it's been amazing from my perspective to see that we can do more and more with less and less. Whereas, surgery is surgery, and there'll always be a need for surgery. But I think because of social media, because of people being driven to not want to get old and then try to look young and just stay looking good, it has forced technology to conform to this. So we can keep people looking younger, better, with minimally invasive procedures, using energy-based treatments and many other things, so that they may not really ever need surgery, or if they do, it could be way down the road. So it's really been a total transformation from my perspective. Oh,
we're losing Joe there a little bit.
So when I do use these technologies to maintain my
We lost you
about
for
that.
just a few seconds, Joe, at the very end for just a few seconds, but I think we got most of it.
And I'm just saying that I think now we can do more with less. We can do energy-based technologies, fillers, neurotoxins, etc., to either put surgery off or maintain and enhance the results that we are able to obtain with surgery.
Great. Dr. Taylor, kindly introduce yourself and tell us about your practice, a style and what you offer patients.
Okay, my name is John Taylor. I'm plastic surgeon in private practice on the Jersey Shore. I've been in practice for about 25 years. Also certified by the American Board of Plastic Surgery and a member of the American Society of Plastic Surgeons. And I have a practice that really covers just about all aspects of plastic and reconstructive surgery, breast reconstruction, skin cancer reconstruction, and cosmetic surgery. And I would definitely agree with everything that Joe said. I think part of it is that we trained in an era where plastic surgery, as you said, was either surgery or no surgery. The non-invasive procedures were available back then, but in some respects, patients weren't really looking for them like they are now. I think a lot of that has to do with social media and patient education now, that people are much more aware that these methods, these procedures are available. But also maybe we were just a little less willing to offer them back then, because most people, let's face it, they did come to us seeking surgery when they walked into our office. Today, that has completely changed. I'd say most people walk in the doors looking for non-surgical procedures rather than surgical. And social media definitely has a lot to do with that. And in our pre-discussion here, Shashi, you had mentioned about all the misinformation out there on the internet and social media on plastic surgery. And something like this, I think, is really important, because I think because we already have a established relationship with our patients, that they would prefer to come to us for information. So I think it is incumbent on us as well-trained and very experienced plastic surgeons to get out there on social media and better inform our patients and put some true information out there rather than a lot of the misinformation that you're seeing.
Thank you, Dr. Taylor. So for the audience also, I'm Shashi Kusuma. I'm a plastic surgeon as well, certified by the American Board of Plastic Surgery. I'm also a member of the American Society of Plastic Surgeons, just like my two colleagues are. I practice in Fort Lauderdale area, suburbs of Fort Lauderdale, and also in Boca Raton. And, the topic today, really, after the introduction, is to talk about plastic surgeons' perspective on the filler market and on the Botox and what we call neuromodulator market, and generally non-invasive procedural space. And so that's what we're going to focus on for the next 15, 20 minutes, and just have a casual conversation to exchange some more of our ideas with the audience. So Dr. Russo, I know you have done something rather unique. You have a school that you built over the last few years that exclusively focuses on teaching various providers, physicians and nurses, nurse practitioners on these techniques. Tell me the genesis of that, and tell the audience now that you're a teacher called Aesthetic Mentor, how much that has played a role in your day-to-day practice today.
Sure. Yeah, and I find myself being more and more attracted to the educational piece, only because there's such a huge need for it. And I think most of the time it's not being done well. And the need, sort of like, you invent the need and a solution occurs. So about, 8, 9 years ago, a couple of my nurses went to take a course to learn how to do Botox. And they flew to Florida, and they took my office manager as their model. And they went to a hotel room, and another nurse flew in from Dallas. And there were like 15 or 20 nurses in a hotel room being trained by one nurse who flew in from Dallas. And they spent, one day doing this. And both of my nurses injected my office manager one time. They weren't even really being supervised. That nurse flew back to Florida. The other people dispersed from wherever they came from. And when my nurses came back to start doing the neurotoxin treatments, they didn't even really know how to reconstitute the product. They knew they had a beautiful binder that was shiny and nice, but they really got very little clinical experience. Their fund of knowledge was very small, and I basically ended up treating them, teaching them myself anyway. That's how it started. And after this happened a couple of times, I looked at my office manager and said, "Why are we sending these people to learn how to do this? And they're really getting a very inferior education. I'm having to do it myself anyway. Why don't we just do it ourselves?" And that's kind of how it started. And we started in the basement of my office, which is about, you've been down there, it's like 400 or 500 square foot space. And now about 7 years later, we're in a 7,500 square foot space, state of the art, just beautiful. And we're training a couple hundred people a year. And we find that we're not really doing any marketing or advertising, but people are coming to us because they're recognizing that we have put a lot into the training. And it isn't really just the training, because as you know, and I'm sure John, as you know, you don't become an expert in anything in a weekend, right? So if you want to learn a new technique, you need to really spend time learning it. So in our model, people come in, they get trained. It's a very intensive training. It's CME accredited, so it's it's all looked through very carefully. But then in order to kind of continue on, they have to hit certain milestones. They have to take practice sessions. They have to get signed off on in front of another practicing NP, and it's like a driver's test. Like you go in, and if you hit the curb during your driver's test, you don't get your license. So here, at that point in time, there's no teaching. You're just expected to show us, and if you don't hit the mark, you don't pass. So it's a very strict criteria. But once you get into our network, we have ongoing CMEs. We have roundtable discussions. We have all of our orders are put through live real time, so that there's always some oversight anytime any nurse ever treats a patient. So there's always an order there. So it's a very comprehensive environment, and it's all about continuing learning, because in medicine you have to continue to try to learn, or you're going to be left behind. So that's kind of how our model is different, but it's all been based out of necessity. And we want to establish ourselves as like the Harvard of medical education for aesthetics.
Great. So Dr. Taylor, also, from your perspective, why, how does a patient, or how do you think a patient should choose somebody to take care of them in this non-surgical, injectable space? Is it, do you feel, or do you believe that plastic surgeons have a different perspective, or do you think dermatologists have a different perspective, or a nurse practitioner? And how does one go about choosing, and what is your advice?
Yeah, well, I'm definitely obviously biased towards going to a plastic surgeon for this type of treatment, but it's not just because of who I am, but it really is based on some pretty strong opinion and education on that. And like Joe, I definitely agree that you just can't learn to do this in a weekend course, or just go away for even a week-long course and learn to become an injector. I mean, the non-physician injectors in my office, they basically watched me for at least a year learning techniques before I even let them hold a syringe in their hand and start doing it. So it's something that takes a long time to know the anatomy. And the bottom line is, no matter where you go, you want to feel comfortable that you're in a place that should you have a complication. Because if anybody tells you that they've never had a complication, then they're either lying, or they just have never done anything. Because everybody does have some complications. But one thing that was drilled into me during my surgical training was that anybody can learn how to operate. My mentor in general surgery, Dr. Marvin Gleedman, well-trained general surgeon, used to say, "Dr. Taylor, I could teach a monkey how to operate, but it's learning good judgment and how to get yourself out of trouble that is the key to surgical training." And that becomes key even if you're having a non-surgical procedure. You need to be in the chair of someone that, should you have a complication or something that requires some urgent treatment so that it doesn't turn into a bad complication, you're much better off being in the chair of a surgeon who's been trained to take care of those complications. I'm sure that Shashi and Joe have seen patients that have come from, a med spa down the street where there's not a physician in sight, where there's a patient with a complication, and they send them to us to take care of it. None of us, I mean, of course we take care of the patient, but of course, no, most plastic surgeons don't enjoy doing it, taking care of someone else's complication. So that's one thing. Another thing is, as surgeons, we've operated on the face. We have a very intimate knowledge of the 3D anatomy of the face. And that is important, not only for injections of technique, but also avoiding these complications. We've seen exactly where those blood vessels, where those nerves are in the face. And, I know I have a mental picture of that as I'm injecting a patient. So I think when you're in the hands of a surgeon, that you're much less likely to have a complication like that. So knowing the anatomy and just the training, I think that all goes into play where you're much better off in the hands of a surgeon, even with non-surgical procedures.
Great points, Dr. Taylor. So, Dr. Russo, so do you use these fillers and non-surgical methods or techniques or products and services in your surgical practice in combination, or do you do them separately and you kind of view your surgical practice as a separate entity or do you blend the two of them somehow for patients?
Yeah, we like to consider ourselves sort of a full service uh, office where we offer, everything from the most intensive surgical procedures to something as basic as a facial and pretty much everything in between. The neurotoxins, the fillers, all the energy-based treatments. We have a special body section. We have a special person who does faces, lots of laser work. So we feel like we want to have the ability to treat anything you need in the aesthetic world. And I feel that, in order to be comprehensive, you have to have someone at the top, a surgeon or someone who really knows anatomy, because whenever something is happening in my office, ultimately I'm responsible. So I want to feel like I'm the master of that, right? And so there are certainly people who are very good at neurotoxins or very good at fillers or very good at lasers, but there are very few people like yourself, John, myself perhaps, that have the sort of understanding the full level of body of knowledge, not only to prevent complications, but also to treat them, but to offer sage advice, to offer, the idea of, more, sometimes less is more, to be conservative in your treatments because you can always do more. One of the things I always talk about in my course is, particularly with neurotoxin, is, you can always give more. Like if you over-treat someone with neurotoxin, you can't take it away. As one of my students said, you can't unring the bell, right? So part of it is just philosophy. Part of it is understanding the potential complications and risks, but also having the foresight to sort of prevent these and sort of get ahead of it. So I think John was right, and I think you were right as well, that we are pretty much the only people who have the full level of knowledge in terms of anatomy, science, physics, and the training. Kind of
Oh, it's frozen again, but while we're waiting for Joe's internet connection to come back on, I'll just add to that. There's that age-old saying that when your only tool is a hammer, all the world looks like a nail. Um, and when your only tool is non-surgical treatments or injectables, then that's the way you're going to try to treat everybody. And again, sometimes we'll see patients come in from other practices where there's not a surgeon, where they said they're doing all kinds of treatments for me, but I don't look any better. And I just look at them and say, well, again, that's because, really, you really need surgery. A surgical procedure is the only thing that's going to get you to your goal.
So do you think there's, the patient base generally this day and age with so much, so much education out there for all kinds of folks understand and, kind of know where to go to get what, or do you think there's still a long way to go to get good information out to the public, even in this day and age?
Good question. Yeah, I know. I don't know if people know exactly where to go. You know, there is a lot of misinformation out there.
I
Um,
think a lot of people are driven by content on social media,
mhm.
that just because someone puts themselves on social media, they automatically assume that they're an expert in whatever they're talking about. And I think that's where people can get into trouble.
So what can we do, Dr. Taylor and Dr. Russo, to kind of be present and be stewards of good, responsible education that is valid, that's real, that's authentic, that's kind of peer reviewed, as we call it, that's safe? How do we contribute to this solution?
Well, I think something like this is a good start because, as I mentioned at the outset, you know, everybody, of course, thinks that their doctor is the best doctor in the world, which we all like to believe anyway. Um, and hopefully that's true for all of you. But our patients tend to come to us for information because we have that established relationship. We have that trust relationship already. They tend to come to us for that information. So something like this, I think, is a good start. Um, we need to leverage social media and technology a little bit better as surgeons to get this word out to our patients and the community at large.
I agree, John. I think, Shashi, education, placing ourselves as educators, not only of the public or our peers, etc., definitely gets the information out there. And when it's coming from a credible source, patients tend to believe it. But honestly, I think education is sort of the highest calling in a way because it's just being truthful about things. So I think if we up our profile as educators, in the end, it will come back and benefit us.
So let's ask some basic questions now a little bit more ground level, I guess, more so than philosophical things that we've been talking about. So Dr. Taylor, what are your favorite go-to fillers that you use, and do you treat a certain age category, or what are the specific areas of the face do you treat, or could you just give us some of your concepts behind just fillers that you use on a regular basis?
Sure. And before I answer that, I just want to add one other point to the previous question, especially for patients out there looking at a Zoom call or a Zoom webinar like this, is also to look to see who is sponsoring or putting on the call or the social media post, because there is a lot out there that is sponsored by the industry. So even though there may be an expert speaker, they may be kind of handcuffed a little bit. I don't know if that's the right word, but kind of restricted to speak only about the product or the company that on whose behalf they're speaking. So it's important to look to see who is sponsoring the talk as well. But to answer your question, as far as fillers, yeah, we pretty much have, we don't stick to one company, one type of filler, because they all have their advantages and disadvantages. So there are different neurotoxins that we use from different companies, Botox, Xeomin, there are different fillers from Allergan, and MERS, and other companies that we use. And as surgeons too, we also have the option of fat grafting, if that's thought to be a better solution. So we just like to take a holistic approach to the patient. Just listen first to what their concerns are, and then just try to put together a game plan that addresses those concerns. And that could be a combination of fillers. Sometimes I'll use two different fillers, say like a diluted Sculptra plus a hyaluronic acid product, together. Could be filler products from two different companies that we'll use in the same patient. So it really depends on the patient's goals.
So this is a common, I would say relatively common thing that I hear from patients I see for the first time. Sometimes they come to you after visiting two or three other places. And I hear, Dr. Russo, them saying, I had, let's just say, Juvederm injected to my face and it didn't seem like it did anything. It didn't work for me. And then so when I'm sure you guys have heard similar things, and what is your response to somebody like that when they say it just didn't work for me?
I guess my first response is to ask questions. Who did it? What product was used? Where was it used? Get as much information, because all the products work. All the technologies work. All the products work. All the neurotoxins work, but they have to be used correctly. And as John was pointing out, certain fillers are intended for certain things. Some fillers are intended for deep injection because they're really more responsible for lifting tissues. Other products are really more suitable for very fine lines and wrinkles. And there's some that are meant to be used in between. And knowing where each product should be used is part of the problem. In addition, when we first started, there were very few complications with neurotoxins and fillers. And now, as time has gone on, the complication rate has gone skyrocketing, primarily because there's lots of new injectors in the market. And honestly, this is just a numbers game. So it looks easy, it sounds easy, and it can be easy if you're very experienced and know what you're doing. But for the novice, for the person just starting out, it's really quite a daunting task to figure out all these products, how they're used, what physical characteristics allow them to be used certain ways versus others, and which neurotoxins are best, because not every product or every neurotoxin is right for every patient. And sorting that out is not easy, and it takes a lot of experience and time.
Completely, 100%.
So this is another question, Dr. Taylor, that I frequently have patients talk about with our practice and with myself, is that, it's about cost, so for example, the quantity of products. So one of the things that comes up is that, how much do I need and what is it going to cost to get an outcome that you want? Because us as surgeons are probably a bit more, in tune to getting, very visible changes versus very, very, kind of maybe soft to no changes. And so one of the things that I struggle with personally is how much to put in so that we actually see a visible change on the table. And that could, cost a bit more than, maybe 1 or 2 syringes. So how do you address that quantity problem of fillers?
Yeah, that can be a difficult thing, because you're right. Some people do come in saying, I have this much to spend, and what can you do for me? But as surgeons, we need to be honest with people. There's a whole there's a business idea of sunk costs. And if you're gonna spend a few $100s on a filler when you really need 2-3 times that amount, that could really be kind of like a sunk cost. You're not getting much out of it. And I think it's on me to really recommend the quantity of filler and the type of filler, because some are more expensive than others, that I think will get the patient to their goal. Now, we never try to overdo things. Sometimes I cringe when I'm out in public and I see some of these results that I just think are way, way overdone. But there really is a minimum amount of product that needs to be used in some patients, and we need to be honest with them. Just like with a surgical consultation, someone needs a facelift, and this is how much it costs, and I say, well, I can't afford that. They come back when they've saved enough money that they can afford it, and it's the same thing with fillers. You just look at it almost as a surgical procedure. That once you've had a consultation, you understand what it's going to take, how much it's going to cost. Then if you need to wait a little while and save up the money, I think that's the best approach. Otherwise, I think you're setting yourself up for major disappointment.
So, Dr. Russo, have you turned people away from doing, the procedure of fillers if you estimate a certain amount and they may not want to do that much, or they may not be able to afford to do that much? How have you managed those patients yourself?
I just wanted to make 2 points as I talk about in my class. What separates an average injector from a good injector from a great injector is that the great injector can get a really good result using half the amount of product that a good or average injector has to use. So I think the better the injector you are, the less product you can use, because of the techniques perhaps that you've developed that allow you to get a good result using half as much product and charging the patient half as much money. Secondly, if you think about how much product we're injecting, I show the patients a teaspoon and say that's 5 cc's of product. And that 5 cc's of product, that teaspoon of product, can cost $4,000 to $5,000. And it seems almost crazy that you could charge that much money for 5 cc's of product and get, a decent result. But when they see how little you're using and how much of a result you perhaps can get, I think it helps them understand. The first time I treat somebody, I don't like to do too much because I don't want to scare them. I think patients are often phobic about being made to look funny. I think once you start changing the way a patient looks, they look in the mirror and they see something different, it makes them scared. So what I tell patients is I want to do enough today to make you see a result and have you buy into my vision for you. You'll need a number of treatments, but I want to start with something that I know is going to give you a noticeable result, but it's not going to scare you. So I generally start out with 2 or 3 cc's in the cheeks, upper face. And I usually just do one half of the face first, and I show them that, because I find that if I show them the side that's done versus the side that's not done, and I point out where their eyes should be looking, and they see that and like it, they buy in, and I ask them, do they want me to do the other side? And they say, of course I do. So what I've done, I think, is I've accomplished the fact that I'm being careful with them. I'm not wasting their money. And with 2 or 3 cc's, I'm showing them a demonstrable difference, and they're buying into my vision for what else that I want to see for them. I'll say, now that we're working on that area, these are the other areas that I think are important for you, and this is the order in which I would do them. Come back as often as you can, as your budget permits. But that's what I feel comfortable with, because I just think over time that's what works for me.
So basically, the summary here is that, create a good treatment plan, explain the vision of the long-term outcomes, and try to, get them to understand, the long-term play here versus a quick come here, get something, because there's, that's really the summary, sounds like. So guys, I think we've spent about 30 minutes talking. I mean, this is something that I personally enjoy a lot, because I really love to talk to patients and, a lot of colleagues without any biases or any industry influences like we're doing. And I think it's good, solid information. If you guys are up to it, we should do this again, periodically, to kind of update, our patient bases like this, and have just, casual, candid conversations. So I thank you both gentlemen for joining me, and have a great Sunday night, and we'll talk again very soon.
Thanks, Shashi. Thanks, John. Talk soon.
Thanks for setting it up. Let's see if we
Bye.
can on this next time.
Bye-bye.
Good night.
Good night.